Nursing Education by Stephanie Beckman at Aspen University. Gameplay is described as being how a learner interacts with a presented scenario or how the learner plays the game. This learning process can take an extended period of time in order for the learner to fully comprehend and master the mechanics of the scenario or game. Effective learning can only take place after the learner understands the mechanics, comprehends the game or scenario, and effectively carries out or accomplishes the intended goal. It is important for educators to understand this concept because it is the role of the educator to determine the amount of gameplay needed for effective learning. This presentation will describe the specific components of an educational simulation scenario which would theoretically be used to teach effective use of an electronic health record system. The first objective of this presentation is to describe the types of informatic competencies which would be utilized in the educational simulation scenario. The second objective is to determine strategies that could be used to both encourage and measure user engagement and interaction with the simulation. The third objective is to describe how virtual reality simulations and real-life scenarios can be designed to provide optimal education. The fourth objective is to describe how available resources and technology may differ in an urban environment versus a rural environment. Finally, the fifth objective of this presentation is to determine how virtual reality simulations and real-life scenarios may be integrated into nursing school curriculums to increase patient, practitioner, and hospital safety. The assessment of competencies refers to the determination of an individual's capability of being qualified and competent enough to complete particular tasks. One study concluded that there are 304 competencies which can be arranged under three primary categories, including computer skills, informatics knowledge, and informatics skills. This portion of the presentation will determine which of these informatics competencies would be most effectively utilized in this educational simulation scenario and why they were chosen. The first informatics competency that I would focus on would be that of informatics knowledge. One article confirms the necessity of this competency by stating that due to rapid innovation in healthcare, there has presented a need to measure and enhance nurses' informatics knowledge. This statement insinuates that in order for today's nurses to keep pace with the ever-advancing world of technology and medicine, that they must be proficient in informatics knowledge and proactive in the continuation and education and knowledge. Additionally, it can be noted that by enhancing nurses' competencies levels with informatics knowledge, nurses may also be more able to effectively contribute to technological innovations and advancements in healthcare. By providing nurses with the ability to effectively and efficiently manage competencies related to informatics knowledge, we are ultimately creating a more confident, independent, and ambitious nurse who has the knowledge and know-how to continue to contribute to continued knowledge growth. Another informatics competency that I would focus on would be that of computer skills. One article describes the necessity of this particular competency by stating that in today's digital age, it is crucial that nurses are proficient at utilizing technological resources available to them in the clinical setting. Today's medical field is rich in technology and only continues to grow more and more advanced in this regard. Ensuring that nurses have, at the very minimum, a basic understanding of utilizing technology and computer skills is an absolute necessity. Absolutely necessary component of today's nursing profession. Another key reason to focus on the competencies of nurses in regards to computer skills and technology utilization is because most facilities have converted all methods of documentation to electronic systems, and as the primary caregiver for patients, it is important that nurses understand how to accurately and efficiently enter data into the system for other providers to view and analyze. While gameplay and live scenarios are often one of the most effective ways of learning certain skills, many people struggle with truly immersing themselves into the scenario in a way that allows them to portray their true responses to the presented situation. This portion of the presentation will discuss strategies that could be used to encourage user engagement and interaction with the simulation. One strategy that could be used to encourage user engagement and interaction with the simulation is to promote a positive learning environment. One way to do this is by emphasizing to the learner that they are in a safe, authentic learning environment, which is meant solely to develop knowledge, skills, and attitudes prior to interacting with real patients, and that there is no real risk for them to cause any harm. Emphasizing that this is a safe environment helps the learner to feel more comfortable and allows them an opportunity to more openly react without fear of doing something unsafe or wrong. This allows the learning process to occur more efficiently. Another way to promote a positive learning environment is by providing encouragement along the way. During the scenario, if the learner does something correct, point out they have made a great decision or that their actions were correct. This provides the learner with confidence to continue to interact and engage more openly as they progress through the scenario. It is also important to note here that in order to further encourage the learner to interact more openly, the learner must be under the impression that the exercise is being done solely for learning purposes, and while there may be some constructive criticism being provided, humiliation and beratement will never occur during a learning exercise. Another effective strategy for encouraging user engagement and interaction with the simulation is to encourage communication between members participating in the scenario as well as between participants and conducting personnel. One article states that by promoting communication at all stages of the simulation, that individuals feel more comfortable and more involved in the scenario at hand. Participants should be encouraged to communicate openly with each other during the scenario in order to promote learning, encourage the critical thinking process, and allow participants to come to mutual decisions. This promotes a sense of involvement and engagement in the scenario being presented. It is also important to encourage communication between the participants and the individual conducting the scenario so that the participants may ask clarifying questions and develop a more real sense of the involvement in the scenario. While the last section discussed how to encourage participant engagement in clinical scenarios, this portion of the presentation will discuss strategies that can be used to measure the effectiveness of the simulation and the knowledge gained by participants as a result of their interaction with the scenario. One way to measure the knowledge gained by participants as a result of the clinical simulation is to have participants complete a self-report questionnaire both before the simulation is conducted and after the simulation and debriefing have been completed. The survey should be used as a tool for determining a baseline of knowledge and the growth experienced as a result of the learning that took place during the simulation. The advancement of the participants' knowledge can be assessed through this pre- and post-simulation questionnaire by asking specific questions addressing the key objectives and content of the scenario. The pre-scenario questionnaire will determine the knowledge baseline for participants, and the post-debriefing questionnaire will serve as a tool for evaluating the areas in which the participant gained clinical knowledge and skills as a result of the simulation. One way to determine the knowledge gained by participants as a result of the clinical simulation is to have participants complete a course content evaluation. A course content evaluation addresses the key content components of the course or simulation and the primary learning objectives that should take place as a result of its completion. The evaluation will ask specific questions relating to the content of the course, and as a result will determine areas of strength and areas of weaknesses in the conduction of the scenario. This evaluation will conclude general areas where knowledge was gained by participants, as well as areas where learning was not conducted as clearly. A course content evaluation will also inquire the participants' opinion about the course by asking where improvements could be made and objectives that they may still be unsure about even after the completion of the simulation. This section of the presentation will determine how virtual reality simulations and real-life scenarios can be designed in order to promote optimal education. One way that virtual reality simulations and real-life scenarios can be designed to provide optimal education is by ensuring that the scenario being presented is a realistic representation of a scenario that the participants may actually encounter in the clinical world. These types of simulations can be designed by taking real-life circumstances, cases, and events from surrounding facilities and incorporating those scenarios into a clinical simulation. This provides participants with a scenario relevant to their practice and presents them with a situation that is very likely to occur in their area of practice. Providing participants with a realistic, relevant, and practical clinical simulation promotes optimal education by ensuring that participants are best prepared for situations that they are likely to encounter in their practice. Another way that virtual reality simulations and real-life scenarios can be designed to provide optimal education is by directly involving the observers of the simulation as well. While it is easy to see how learning can take place with those involved in the scenario itself, it is equally as important for learning to take place with the observers as well. One way to ensure that active learning is taking place with observers is by assigning them to the task of leading the debriefing session after the completion of the simulation. This transforms passive observers into active participants, ultimately optimizing learning for all individuals present. This section of the presentation will discuss how available resources and technology may differ in an urban environment versus a rural environment. The availability of certain resources and technology can differ greatly between an urban environment and a rural environment. One article discusses this significant difference by stating that the association between emergency medical services response time and improved survival rates has been strongly established. In most urban areas, the concept of a quick response time and timely transport to an appropriate medical facility is not only a feasible goal, but is actual expectation. However, in more rural areas, the unfortunate reality is that the same expectation simply cannot be applied. This same concept applies to almost all aspects of providing care for individuals residing in urban areas versus rural areas, and the fact that oftentimes it is simply not convenient or practical for all of the resources that are available for urban areas to be readily available in such remote rural areas. Additionally, there is generally not as large of a demand in these areas, making it difficult to justify the availability of all the same resources in these rural areas as well. The following slide will discuss specific instances in which the availability of certain resources differ between urban and rural environments. To further portray the significant difference in available resources between urban and rural communities, I have created a table discussing specific resource availability for each area. The first is general resource availability. This could include anything from supplies, businesses, vendors, etc. General resources are much more available to urban communities than rural communities due to the increased amount of businesses available to these populated areas. Rural communities have significantly less resource availability because there's less potential for business to gain revenue in areas that are less populated. Next is technology availability. Urban communities generally have easier access to technology and technological resources due to increased demand from businesses and residences. Where there are more people and more businesses, there's more of a need for technology. That being said, in rural areas where many businesses and residents are spread further apart, it may be difficult for technological resources to make themselves available to service such remote areas. In regards to medical facilities, urban communities certainly have increased availability as opposed to rural communities. In urban communities, there are generally multiple nearby options for medical care, some that advertise specialized modalities to specifically fit the needs of patients with particular medical ailments. In rural communities, however, there may only be one major medical facility available to the entire surrounding community, and if a patient needs specialized care, they may need to be transported to a larger facility in a more urban area to receive the care they need. Finally, as previously discussed, the availability of emergency response systems is significantly more notable in urban areas as opposed to rural areas simply because of the proximity to busier facilities. EMS stays busiest within these city limits, and these remote locations in many rural areas make it difficult to justify a constant presence of emergency medical services. This final section of the presentation will discuss how virtual reality simulations and real-life scenarios may be integrated into nursing school curriculums in order to increase patient, practitioner, and hospital safety. Virtual reality simulations and real-life scenarios can be integrated into nursing school curriculums in order to increase patient, practitioner, and hospital safety. These training scenarios can be integrated into hospital programs by creating a new scenario for each objective within the course of each nursing program. For example, during a medical surgical nursing course, each of the primary objectives of the course is addressed in the classroom. The student will then participate in a virtual reality session, simulation, or real-life clinical scenario in order to put their new knowledge to use in a safe and controlled clinical setting before being put in a situation with real patients. One article mentions that nursing academics are encouraged to utilize simulations in their programs in order to allow students to address their fears and unease in a safe environment and work to promote confidence and skills before entering a clinical environment. The practice of virtual reality simulations and real-life clinical scenarios in nursing school curriculum significantly increases patient, practitioner, and hospital safety by allowing students an opportunity to apply their knowledge and practice their skills in a safe and controlled environment before encountering a real patient. These scenarios allow for the safe allocation of common mistakes and misunderstandings among young nurses and allows them the opportunity to learn and grow from these mistakes in a safe environment before potentially making mistakes on a real patient in a clinical environment. These types of scenarios also allow students the opportunity to ask questions about skills and seek clarification on anything they are not grasping. Additionally, participation in these scenarios builds confidence in new nurses and helps to ease the fear that comes with being in a clinical environment. All of these factors work together to provide a safe learning environment for the student, as well as promoting a safe environment for patients and facilities accepting these students as well. In conclusion, the first objective of this presentation was to describe the types of informatics competencies which would be utilized in the educational simulation scenario. The second objective was to determine strategies that could be used on both to both encourage and measure user engagement and interaction with the simulation. The third objective was to describe how virtual reality simulations and real-life scenarios can be designed to provide optimal education. The fourth objective was to describe how available resources and technology may differ in an urban environment versus a rural environment. And finally, the fifth objective of this presentation was to determine how virtual reality simulations and real-life scenarios may be integrated into nursing school curriculum to increase patient, practitioner, and hospital safety. These are the references which were utilized for the purpose of this presentation. Thank you for your time and attention.